So we are starting right away. This is just an overview. This is just an overview about the nursing process. So we just want to know that we have steps in the nursing process. And usually we term it as advice. So like I was saying, we have 5 steps in the nursing process: assessment, diagnosis, planning, implementation, and evaluation. But quickly, we want to move on to why we are meeting this event. That is the care plan, drawing the care plan, and things you need to know as a nursing student. Usually students complain that they are not able to finish the nursing care plan during examination. So if you know that you have 30 minutes to finish a care plan, and you are expected to write 4 patient problems, objective or subjective. If you say objective, you're talking about problems that you can see. When you go to the patient, sometimes you can see that their fingernails are overgrown. Those are objective problems. Or if patient is having catheter in situ, urethral catheter in situ, they are objective problems. Then the subjective problems are the ones that the patient will tell you. For instance, if the patient tells you that I have pain in my abdomen, that is a subjective problem. Okay, so when you write 4 problems, that is what we are looking at. So each student is assigned to a patient to assess to. This is something you have to know. And you are expected to fill the sheet to the other section. I have a sheet on the presentation that I will show. Some of you that have not seen the sheet have a fair idea. And out of your orders, a task selected for you to perform. Then after, you take the sheet and do your intervention. Okay, so we'll move on to the next thing. So this is a sheet showing how the nursing care plan looks like. So from what we are seeing on the screen, this is the front sheet. Okay, usually most of you waste time trying to find all the details about the patient, occupation, physician, and all that. Bear it in mind that we have only 30 minutes. And this 30 minutes is covering all the things you are doing to the other section. So you don't need to waste so much time here. I gave a little marking scheme idea here so that you all know what you are looking at. So in 30 minutes time, you are expected to do that front sheet to get only 6 marks. So imagine you are going to have 6 marks for what you are doing. Imagine you are going to have only 6 marks for all the front sheet. This one you are doing for 6 marks. Then the next thing is the actual nursing care plan, which carries 12 marks. So you don't want to waste time on the front sheet. Then we have the last section too, which carries only 2 marks. Sometimes you come and find students trying to write almost like 8 medications on patients when they have not even started doing the actual nursing care plan. So you end up wasting time. And the medication side, the marks for medication is 1 mark. Other treatment is half mark. Then we have investigation being also half mark. Hello, please, can you hear me?
Loud and clear.
All right. So we want to look at, so when you write from the name of the patient to the date of discharge, it's only 1 mark. The patient problem, each one problem that you state that is correct will give you half mark. If you state a problem that is correct, gives you half mark. So total will be 2 marks. Then the allergies you write for the patient, you have a half mark. So this is the front sheet we are talking about. Then we move to the patient strength. Every patient strength should correspond to the patient problem stated. So, for instance, if you stated that patient complaint of abdominal pain, we are expecting that that's your number one. Then number one strength should be corresponding to the pain you note. So you don't write abdominal pain as patient problem, but you state it as patient complaint of abdominal pain. So if you don't state it as a problem, it's wrong. And then the strength becomes patient verbalize the intensity of the pain or the location of the pain. So when you write anything that does not relate to number one problem, that makes your strength wrong. These are we together. So when you write a corresponding strength, it makes it correct for the problem. Then the routine care, as we see on the sheet here, routine care, all these things from temperature, pulse, respiration, blood pressure, diet, and to activity gives you the mark we are showing on the screen here, 1 mark. So total of 6 marks. Then the actual nursing care plan, we have 12 marks for all. Each care plan carries 4 marks. So we mark 3 correct nursing care plans. So that means that if you're able to do 4 of them, because you have 4 problems stated, then we are going to take your 3 best mark. So for instance, if you had 3, 4, 2, 1, the 1 becomes the least mark. So we are going to take 3, 4, and 2. Please, do we understand? Or are we together? Yes. So every correct diagnosis with a related factor also gives you 1 mark. So for instance, if you state acute pain into brackets abdomen related to let's say if the patient had peptic ulcer, then we are relating it to increased acid secretion or over secretion of the ACL in the stomach. Then we get 1 mark for that diagnosis. But when your diagnosis is correct and your related factor is wrong, you are getting half mark for that. These are it together. And the moment your diagnosis is wrong, it makes all the things you have written wrong. If it is not in the NANDA diagnostic label, it makes your whole diagnosis wrong. So sometimes you can write exam thinking that you are coming back to get good results. When school reopens, you realize that you come back and your results does not reflect what you think you wrote. So an objective and outcome criteria also carries 1 mark. That means that we have 2 parts of this objective and outcome criteria. So the objective is half and the outcome criteria is half. So if we are looking at pain, for instance, a patient pain will be reduced within 30 minutes as evidenced by maybe nurse observing patient having relaxed facial expression in bed, and then the patient verbalizing reduction in the pain. That will give you 1 mark. So when you write only the objective part and you get the outcome criteria wrong, you are getting half. I hope we are understanding the whole thing. I want us to understand the whole thing before we touch on a sample and we get the ball rolling. Okay. So every valid order you give, if you give 4 valid orders, sometimes you can write like 6 orders, 5 orders, but when we say valid orders, we mean that at the end of the day, it should tally with the diagnosis that is stated. So sometimes you see students write check vital signs for a problem of, let's say, patient complaints of inability to sleep, such a problem. Then you realize that the student is writing the same orders for pain, for sleep. So the moment we see a deviation, everything you have written there is wrong. Then four correct interventions to give you 1 mark. Then the evaluation is usually not marked. It's bonus. But when an examiner realizes that you are doing well, sometimes they give the half mark when they realize maybe you were falling short at some places. For instance, if you are writing well, so writing well in exams also makes examiners give you some marks. In fact, there are a lot of people that when they write and they are marking, it's something else. You can't even see what they are trying to write. So let's do what to write for when we are doing our examination. So we are moving on to, let's move to the proper. This is what we are going to touch on today. So um I hope you can hear me. We are about to touch on the care plan into details.